This complementary therapy is increasingly popular as a way of treating a whole range of baby and toddler problems. Teething, windy or irritable babies can all be helped, as many new parents swear by osteopathy as a way of helping common ailments. So how does it work?
If you think about all of osteopathy, paediatric osteopathy is just osteopathy. We're doing it on small people who are slightly different to big people, but it's the same principles. So osteopathy is really looking at structure and function and movement. So what we're interested in is how the structure affects the function, how the function affects the structure, and how everything moves in relation to everything else. And so what we're doing is looking at those complex relationships, whether it's with the bones of the head, which is sometimes something that we'll focus on with babies, or whether it's if you've got a baby who doesn't crawl properly, whether it's through the bones of the pelvis and how the lower extremities, the legs are actually moving and how that's affecting the balance through the pelvis, or how certain muscles are affecting that balance. And if a baby comes out, for example, that's been quite compressed or quite tight and quite tightly packed, then certain areas may be compressed and that can affect movement and balance. If they've had one leg very tightly tucked up, that can affect the hip balance. So we'll be looking at all of those things, assessing all of those things, and then very gently encouraging the body to correct, because everything has a blueprint for health. And what's lucky for us is that babies are very much closer to that blueprint than we are as adults. We haven't had all those years of falls and knocks and postural bad habits. So with a baby being that close and with a child being that close, it's a lot easier to re-establish that health and the patterns for movement that baby already has.
The variety of problems that paediatric osteopaths can treat is extraordinary. As well as the more common childhood ailments here at the Osteopathic Centre for Children, their work has also proved to be effective with more serious conditions like autism, epilepsy and cerebral palsy. The treatment for these children aims to support their recovery by alleviating their symptoms and making them easier to manage.
Here we certainly have a number of severe conditions. We see children with epilepsy, quite chronic, severe epilepsy, and also the milder forms. We see children with cerebral palsy, children who have Down syndrome, and other sort of genetic conditions where they don't even have a name. And treatment's not going to cure the condition, but what we do hope to do is to help that child function as best they possibly can within the problems that they have.
This is 8-month-old Kai, who's been diagnosed with cerebral palsy. His mother, Amy, brought him to the OCC to see if they could help him with the loss of movement in his right arm. He was also very distressed and having problems sleeping. Amy's already noticed an enormous difference in Kai's condition since he's been to the centre.
When he was a baby, he never used to move his right arm at all, did he? And now he's starting to use it and play with things, trying to hold his bottle. He's really trying to move it. It was just like stiff before and he held it back. His right arm he is starting to use a lot more since he's been coming here, that is. And he's been kicking his legs a lot more.
When you see a child with cerebral palsy, the cerebral palsy may be affecting different areas, so it may be as mild as just one tight arm, or it may leave them very chronically affected, very severely affected. And again there we're just looking to give them the best quality of life that they can have and to get their function as good as it can be for them and their health as good as it can be for them.
Paediatric osteopathy is a very gentle manual technique that works to make sure the body's framework is in alignment, allowing a good blood and nerve supply to internal organs, and relieving any tension in the muscle and bones that could be restricting movement. This is particularly important where there's a physical disability such as Kai's cerebral palsy. 4-year-old Joe also has this condition, as well as severe epilepsy, sometimes suffering from over 100 fits a day. Since being treated at the OCC, Joe's seizures have been dramatically reduced.
He's just generally a happier, much more contented child. He's beginning to learn more as well. There's nothing you can really put your finger on. It's just that everything has come together.
With epilepsy, most of our children that we see will be on medication, and that affects the brain as it's supposed to, but it can also affect how the brain develops on a very subtle level. So again, what we're trying to do with those children is to really encourage their systems to work within the medication, and sometimes having a fit can be quite a shock to the system. We talk about things in terms of feelings and qualities, a bit like a wine master might talk about different tastes of wine. And they might say wine's chocolatey or peppery. Well, we talk about tissues being dense or hard or shocked or irritable. And some people who've recently had an epileptic fit, the tissues, the coverings of the brain, the meninges can feel very, very irritable.
Lucas is 3.5 years old. He was born at just 30 weeks and has mild cerebral palsy as a result of a brain hemorrhage at birth. He also has to live with a cyst on the left side of his brain and needs help to keep his movements coordinated.
The cyst is affecting his right side of the body, and mostly the legs. So it affects his balance mainly, and we do physiotherapy with him, but I found this treatment to be the best treatment out of the lot, basically.
In an ideal world, every newly delivered mother and baby would benefit from a postnatal checkup from a paediatric osteopath to ensure that the effects of labour, delivery and birth don't go unresolved. Lauren Stevens decided to bring 6-day-old Lola to the Osteopathic Centre for Children so that both she and her baby could be treated.
Yeah, I mean, a lot of it is just really helping her body adapt to the changes of having given birth, because it's actually one of the hardest things that most of us will ever do. And it's, for some women, it can be almost like running a marathon. I mean, it can be a huge, long process. And part of what we want to help her to do is to help the pelvis to settle back down into its pre-pregnancy position, to help the internal organs settle back down to their position. Things gradually change and normalise anyway, and the body's very well designed to do that. But if you've had a very long labour or a very difficult labour, the body doesn't always do that quite as easily. So that's one of the things that we can do.
It isn't uncommon for women to experience problems after birth, from low back pain to headaches, stress incontinence to pain during intercourse, all of which can be addressed that much more easily shortly after the birth. Lauren's baby needed an assisted delivery using Ventouse, and that's left her head slightly tender and misshapen.
Sometimes, well, what we're looking at is the skull is almost like a membranous bag at this point in time. That it's got bony stiffeners in it, but it isn't the sort of elaspoioric variety of skull that we associate with what a skull looks like. So it's actually much more fluid and much more membranous. So when you apply a Ventouse, the Ventouse obviously compresses, and you put a lot of pressure on to then pull out, and that can compress some of the structure that we call the tentorium, and underneath the tentorium and around the tentorium there are vascular sinuses. So they can actually get a bit of a headache from that compression and that congestion, as well as obviously having a bruise, some of them from the Ventouse.
Kate Hammer was helped through a difficult pregnancy by the OCC when she suffered from preeclampsia, a condition affecting 1 in 10 pregnant women, where they develop high blood pressure together with protein in the urine. The ante- and postnatal care offered by the centre for her and her baby Audrey have helped them throughout.
I had preeclampsia, so from week 28 I was actually quite ill, and I really relied on the treatments that I was getting, and just the support and caring I was getting here. And the day before Audrey decided to come 4 weeks early, I was treated, and Luciana, the osteopath, said this baby's ready to come out, which was very reassuring when I found myself at the hospital the next evening and it was all happening.
Audrey, who is now 13 months, was born 4 weeks early and stayed in hospital for a month. She's now back on track, but needs some treatment for mobility.
When we look at children, we look at how the hips internally or externally rotate. So we've been looking at that with Audrey and helping that one that tends to turn in to release back out. And then we've also been working on the spine, on the muscles of locomotion, and on sort of higher up during the spine, which is where you do your walking from.
Pregnancy is a time when many women become more aware of their bodies. And for many, pregnancy means having to cope with a whole range of symptoms, from low back pain to morning sickness. Osteopathic treatment during pregnancy can help the body adjust to these changes. Carol Smart is 30 weeks pregnant. She gave birth to her first child prematurely and is hoping the Osteopathic Centre can help her cope this time around.
Well, if we talk about pregnancy as a whole, basically with pregnant women you've got a lot of changes to adapt to and a lot of hormonal changes as well as physical changes, so we can help the body as it learns to adapt to those things. As your baby grows, not only does your posture change here, but often your breasts increase in size, and that can put a lot of strain through the upper back as well. Carol was actually experiencing some low back pain, and again often the sacroiliacs can be a source of discomfort for a lot of ladies as the ligaments soften. The ligaments particularly through the pelvis will soften, but she was starting to experience some pubic symphysis pain as well. So one of the things that we're going to be doing for the next couple of months through her pregnancy is hopefully to monitor that, to help to reduce the stress of the developing and growing baby on the low back and also on the symphysis pubis.
Because baby Chayana was born 3 months early, the OCC are keen to keep her closely monitored. She's now 11 months old and doing very well, and although just here for a checkup, Carol is concerned about some dry patches appearing on Chayana's back, but also about her general development.
With a child that's early like that, we need to look at their neurological system, so we need to see whether or not they're covering all their milestones, because some premature babies can be a little bit delayed in those. And she was doing very, very well, but the thing that we really noticed today was that when she was righting herself, which is a reaction that we all have, she wasn't righting herself quite as well when she was going over to that right side. So she was losing her balance more easily, and then when we asked Mum, she said yes, that is what happens. So, and what we actually found was that an area that's quite tight, typically on premature babies at the back of the head, was actually still quite compressed on her and very, very slightly rotated. So we were trying to release that, which will help the area that affects balance.
Charlotte Reynolds had osteopathic treatment while she was pregnant and has returned to the centre to have her 11-month-old baby treated for his eczema. Charlotte believes that this complementary therapy has improved Seba's skin condition alongside the conventional treatment under her GP.
Our job ideally is to try and help them to get off their medication, but that's done over a period of time where the patients, parents either slowly withdrawing medication in consultation with their GP or their specialist as they can.
So, I mean, how's he been?
Really up and down with his eczema.
Yeah.
Sometimes it's been fantastic and we'll be off the steroid creams for a week, and other times it's bad. And he's been reacting again to food that I've been eating.
Breastfeeding Seba is beginning to cause a problem as it's hard to isolate his allergies while he's still relying on Charlotte's milk. David, Seba's osteopath, is looking at ways to isolate his allergies, and before he begins the treatment, his consultation is thorough. Often, paediatric osteopaths can diagnose problems that may have been missed by health visitors or regular GPs. The OCC believes that by treating relatively minor problems in infancy, future health is less vulnerable. Leaving a minor problem without treatment means that even while a child's body adapts to it, and even if it clears up eventually, there still remains a long-term negative effect. So, although the clinic does not offer miracle cures, sometimes the health of sick children can improve enormously.